Thank you. Hi, how are you? I'm Angela. I'm going to wash my hands and I'll be right with you, okay? All right, thank you. I'm going to wash my hands with soap and water. Hello. Provide privacy, close the door, pull a curtain. I'm Angela. I'm an Excelsior college nursing student, and I'm going to be caring for you along with your other nurses. But before we go any further, I want to verify who you are, okay? And I'm going to do that by asking you to state your name and birthday. And then I'm going to compare my mark to your bracelet, okay? You tell me your name. Janet Ham. Your birthday? 6/24/1981. 6/24/1981. Thank you. So what I'm going to do is I'm going to get your oxygen level. I'm going to put this on your finger. And while this is reading, I'm going to check the machine and make sure you're getting 2 liters like you're supposed to be getting, okay? So you have the cannula, and it's running at 2 liters. That's good. Let's see. Your oxygen level is 96. That's good. So, but before we go any further, I want to sit you up. And you know why I want to sit you up? Yep, for comfort, but also by you sitting upright, it will help your gas exchange. You're kind of slouched down in the bed or whatnot. It's okay. Your oxygen level is at a 96. That's great. But we want you to be sitting up as much as possible. What's comfortable for you. And by the way, what would you like me to refer to you as? Janet? Okay. Okay, Janet. So, Janet, if you're sitting up, the gas exchange, it will be a lot better. And it's comfortable for you, but it helps, the oxygen level stay increased. Like I said, you're good, but we can always be better. Okay, so I'm going to sit you up. Are you okay with that? Okay. I'll sit you up. There you go. Just come up a little bit. Yep. There you go. So how is the tubing? Is that comfortable for you? Okay. So I'm just going to check out the tubing actually. I'm going to look at it, make sure there's no kinks in it. And then I'm going to look at your skin around the tubing. You know what I'm checking for when I'm checking the skin around the tubing? Well, if the tubing moves, it can cause skin breakdown by the friction of the tubing. So what I'm checking for to make sure it's no skin breakdown. And the first sign of skin breakdown is red in areas. So I want to check and make sure you don't have any red in areas. And while I'm at it, I'm going to check your mucous membrane, your nose, and your lips to make sure that it's moist, not chapped or anything. Make sure you're good and hydrated, okay? Okay, so let me check behind the ear. Good, the cheeks are good. Come on this side. Cheeks are good. Okay, we do have a little bit of redness here behind the left ear, but that's okay. I'm going to take care of that. Can I have the pen light? If you can open your mouth for me, I just want to look in your mouth. Make sure it's moist and look at your lips and also your nose. Okay, mucous membrane is moist. No chapped lips, no chapped nose. Everything's good there. Great. Now also, I'm just going to pull the cover back a little bit and just look at your chest. What I'm checking for is your respiratory rate. Make sure you're not breathing too heavy, breathing too slow, just to make sure you got some good breathing going on here, okay? Okay, and that's good. And let me jot some things down here. If I don't jot it down, I will forget. You had 96 oxygen. So your respiratory, like I said, your respiratory effort was good. So the tubing is good. You're at 2 liters like you're supposed to be. Yeah, 2 liters like you're supposed to be. And then, so what I'm going to do is I am going to put a little bit of cotton behind your ears. Now I know that I said the left ear was reddened, but I'm going to put a little bit of cotton behind your right ear also. And you know why I want to do that? Yeah, for comfort. But I also want to do that so we can try to prevent redness. Okay, since we got a little bit of redness over here. You know why I'm putting it over here, right? Yep, because it's red, but also to prevent further skin breakdown. You got me? Okay. So, now you set up and everything, and we make sure the machine is good and no kinks, so it's running good. And so that's all the movement I need to do for you. So I want to check your oxygen level, being that we set you up, okay? See if there's been any changes. Oh, we got 98. Okay, that's 2 difference. So that's good. So like I said, that sitting upright will help you breathe better and by helping the gas exchange or whatnot. Gas exchanges mean breathe better or whatnot. So that's that. Can you tell me anything that you learned from me since I've been here messing with you and your oxygen? Anything that I told you? Yep. The cotton behind your ear is going to prevent the skin breakdown, and on the left is going to help to prevent further skin breakdown. Yep. And the friction from the tubing moving is what causes it. Yep. So we just want to watch that. So if you feel any irritation or anything anywhere where the tubing is, anywhere on your body, but anywhere on the tubing, you be sure to let us know, okay? And we can do something to provide some type of comfort for you, okay? And what else can you tell me? Yep, sitting upright. Sitting up will help. Oh, you remember gas exchange, which means breathing. Right, it didn't help your breathing. You're right. Okay, I just didn't want to leave out of here without teaching you anything or clarifying. Okay, is there anything else that you need before I leave the room, Janet? I'm going to go out to the nurse's station and do some charting. So if you need me or any of your nurses, you just ring that call light and we'll come. Okay? And do you know how to work the call light? Yep, you just push that button down. Yep. And you don't have a bed alarm. Your side rails are up. Your bed is low and locked. And then you don't have any clutter. We want to make sure you don't have any clutter, because I know when you get up you got that tubing. You don't want to trip and fall. So everything looks good here. Okay. Let me jot something else down before I leave the room. Okay. So I got everything. All right, so that's it, Janet. So if you don't need anything, like I said, I'm going out and just push that call out if you do, okay? All right. All right, so the documentation will be below in the description. And something else I wanted to say. I can't remember. All right, thanks, guys.